Hi, this is Sue for Parkies and Me, my journey with Parkinson's. Today I thought I'd talk about complex comorbidities. Now, I know I've spoken about this before, but having a body that does have a number of things going on with it is probably going to be an ongoing theme from time to time, as I try to address each thing as an individual condition and also as something that affects other parts of my body as well. Now, my latest issue is something that I've brought to the attention of my doctor for about a month, and it's an issue with particularly my left foot. Now, out of the blue, seemingly, this left foot started to get a bit achy, and then it started to get quite sore to the point where it's sore to the touch. And talking to my GP, he acknowledged it, he checked it, but there doesn't seem to be any kind of plan to actually address the issue of the pain in my foot. So this is getting to be a bit frustrating. Now, as anybody who has followed my blog will know, I am recovering from quite major back surgery because of a trapped nerve situation, is the easiest way to describe it, in my back, which has caused pain down both my legs. And that pain had been quite significant. I'm pleased to say after my surgery that pain has actually gone, but I'm wondering whether there might be some residual effect. So the left foot is the one that's mainly affected, and so what happens is it's sore to the touch, but also when I flex my foot, that sort of area where your foot joins your leg, that sort of crease bit where it bends, it's quite hard to describe exact places where pains are sometimes, isn't it? So anyway, doing my best to describe it. So the bit where my foot joins my leg and it sort of flexes is quite sore in there when I do that. And it's becoming quite bothersome. When I've been sitting for a while, it can get quite sore when I get up. Also, when I've been sitting with my feet up, I can get tingling in my feet, numbness and tingling, which is what I had before. So I'm hoping that isn't a return to my issues that I previously had pre-operation. I've looked at Google. Yes, I do Dr. Google from time to time. And I've looked at Google and put in Parkinson's and foot pain or foot issues or something along those lines. And it does appear that toes and feet can be affected by Parkinson's. Now, when I suggested this to my GP, he seemed to think that was unusual or not something that he would consider. I do wonder whether, as he is a GP, and a great GP at that, whether he is not fully aware that Parkinson's can affect your feet. So that's one angle. The other thing is I've had a knee replacement and several finger joints replaced because I have arthritis. And arthritis can also cause issues with your feet and toes, which I think is my GP's preferable diagnosis that is likely to be with my arthritis. So that's the other sort of angle. So it gets really confusing. I am under a neurosurgeon for my back surgery, and I'm wondering, should I contact the neurosurgeon in case it is some ongoing swelling that might be causing my pain in my foot, or something that is still trapped and needs to be attended to. God, I hope not another operation. I don't think I can handle it. So it could be a post-surgical complication or just a recovery thing that happens that may resolve itself. I'm also under a rheumatologist who I haven't seen for quite a while and who has been involved with me since my arthritis was first diagnosed. And I used to have the number of his nurse and could just ring up and she would get me in to see him. Now, I haven't had to do that for a while. My arthritis, touch wood, has not been too bad. In general terms, it has been deemed to be responsible for my knee, which then, of course, had to have knee replacement surgery. I wonder if I rang the rheumatology department and asked to speak to my rheumatologist nurse, whether I might be able to talk that through with her and get in to see my rheumatologist. I do feel it's been maybe 2, could even be 3 years since I saw my rheumatologist, so perhaps a checkup for that would not be a bad idea. So that's another thing to talk to my GP. Also, my neurologist who diagnosed my Parkinson's also has a nurse attached to his practice. And so I'm thinking maybe I should ring her and tell her what I'm experiencing, so we can find out whether there's a remote possibility or a more definite possibility that the issues with my toes and my foot could be in relation to my Parkinson's. So yes, I'm a confused sort of mess of symptoms and possibilities at the moment. I'm not sure who's more confused, me or my doctor, but we don't seem to be getting anywhere. So the thing that I want to avoid is not addressing it and it becomes a mobility issue, which we are not ready for. My balance is good, my tolerance for exercise is increasing. I'm starting to feel like I'm literally getting back on my feet post-operatively, and I don't want this sore foot to become the thing that derails all my hard work. Yeah, it is difficult when you have a number of different conditions to know which one of them might be causing something, and it may conceivably be something that's caused by everything, by my arthritis, by my Parkinson's, by my back issues. It could all be everything rolled into one, and there's no one culprit. But I really do need to have something done about this. So I think the secret here, the way forward, is to use my advocacy skills, as I would do for any patient that I work with, to advocate for myself, to get some answers, and not to just go, my foot's really sore, but there's nothing that can be done about it. I'm sure in this day and age there must be something that can be done about it, and there needs to be. So watch this space. I go to the doctor today, and hopefully from here I will get x-rays, or I will get referrals, or I will get a plan so that I can manage to address this pain issue before it comes to be something chronic that affects my ability to mobilise. So yeah, here's me feeling a little bit concerned, a little bit confused, a little bit hopeful that hopefully my doctor will be able to assist me to get a plan together today. So this has been Sue talking about complex comorbidities and how they affect me at the moment. So this has been Sue for Parkies and Me, My Journey with Parkinson's. Kia kaha, be strong, be brave, be you.